Hello, I'm Dr. Mark Daly. I want to thank you for taking time to visit our website and watching this video. My most sincere hope is that by watching these videos and reading the following report, you'll be taking your first step to actually getting the relief you've so desperately been looking for. I know some of you have literally been to dozens of doctors looking for relief, and for many of you, we may be your last resort. You're tired of hurting, you don't sleep well, every muscle in your body aches, you feel like you have the flu 24/7, you're depressed, not enjoying life, you may even have thought of taking your own life for that matter. Please don't do that. The last thing I want to do is give you false hope. But I will tell you that with our metabolic and brain-based treatment of fibromyalgia, hundreds of sufferers have found relief all across the country. Now, I've been a chiropractor for 13 years, and I have had the good fortune of helping thousands of people and consulting with dozens of companies in order to reduce and repair a variety of spinal conditions. But recently we've made life-changing discoveries that bring relief to people suffering from chronic pain. It's a metabolic and brain-based treatment that has worked with literally hundreds and hundreds of fibromyalgia sufferers. Dr. Michael Johnson, a board-certified chiropractic neurologist, has mentored a handful of doctors in this metabolic and brain-based therapy, and fortunately I'm one of those doctors. We're going to present a tremendous amount of information that is designed to free you from the life-altering pain you've been living with. After watching this brief video, I'm going to introduce you to my colleague and mentor, Dr. Michael Johnson. You'll watch his video by clicking on the link below. We successfully use these metabolic and brain-based techniques right here in our Springville office. Springville is just 20 minutes north of Birmingham on Highway 59. Let's talk for a minute about how to finally end your fibromyalgia nightmare. And really, what makes us different? Because we don't treat fibromyalgia. What we do is we care for the patient. We support them metabolically and neurologically and allow their body to do what it does best, which is heal itself. But we leave no stone left unturned to determine the exact cause of your fibromyalgia. We use metabolic treatments based on specific lab panels. By using specific blood tests like a thyroid panel, a complete metabolic panel, a lipid panel, a complete blood chemistry with autodifferential, we can assess your thyroid, your adrenal glands, your liver, your kidney, your white, your red blood cells, and your gut function. All of these can be affected by fibromyalgia. If we can fix those, we help you heal faster. We do sensitivity testing. We do stool samples to determine if you have a sensitivity to gluten, to wheat, to rye, to oats, to barley, to milk, to eggs, to yeast, and soy. If you are sensitive to any of these food groups, it could be making your condition worse, and it will increase inflammation in your brain and throughout your entire body. If you have the following symptoms, you could be suffering from sensitivity to one of the aforementioned items. Here are some of the symptoms or to these sensitivities. Chronic pain or fatigue, frequent indigestion, bloated after eating, frequent loose bowel movements, constipation. The only way to find out if you suffer from these sensitivities is quite simply run the test. We do adrenal stress indexes. We can further test your adrenals with a test called the salivary index stress test. This is a salivary test, so we use your saliva. It's a lot like a DNA test. Your adrenal glands are your stress glands, or your stress organ, meaning that they react to stress. If you've been or are currently under stress, it's a must to take this test. Now, if you suffer from insomnia, this test will measure your cortisol levels. When your body's cortisol levels are abnormal, you will oftentimes suffer from insomnia. Cortisol levels can be corrected via a specific nutritional protocol, eliminating your sleeplessness. Autoimmune disorders. We may test to see if you have an autoimmune disease. An autoimmune disease is where your immune system attacks a particular area of your body, be it the nervous system, the joints, the connective tissue, the thyroid. So we test for specific antibodies to determine if you suffer from an autoimmune condition. The immune panels give me a real in-depth picture as to exactly what's happening with your immune system. If you suffer from an autoimmune disorder, it trumps everything else, and it must be the first thing we look at. We can run a test for H. pylori bacteria to determine if it's causing any problems related to your gut function. We do intestinal permeability test. We used these to see if you have leaky gut syndrome. Leaky gut describes a condition of altered or damaged bowel lining, which is caused by antibiotics, toxins, poor diet, parasites, infections, which can lead to increased permeability of the gut wall to things like toxins, microbes, undigested food, to waste, or larger than normal macromolecules. We do hormone panels. We can check hormone panels to determine if the patient suffers from low testosterone in males or low estrogen or progesterone levels in females. Symptoms related to hormone levels may include depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and decreased physical stamina. Finally, we may need to test for inflammation in your system by testing homocysteine levels and C-reactive protein. Many patients suffering from chronic health conditions suffer from the inflammatory process. Just about every fibromyalgia patient that I have treated suffers from some kind of chronic inflammatory process. Glutathione. We use glutathione in all of our treatments of chronic conditions. Glutathione is literally the mother lode of antioxidants. Glutathione cannot be taken orally in pill form because the body won't absorb it. We have seen miraculous changes in our patient population as a result of our specific glutathione protocols. Let's talk for a minute about our brain-based neurological treatment. Oxygen therapy is fuel for your brain and nervous system. Your brain and nervous system need two things to survive. They need fuel and activation. Fuel comes in the form of oxygen and glucose. By using oxygen, we help you heal faster. By using exercise with oxygen therapy, we can increase firing to the brain. By increasing firing in the brain, we have helped many chronic pain conditions. In this brain-based treatment, we use vibration. Vibration fires up the back part of your brain called the cerebellum. One of the functions of the cerebellum is to control the spinal muscles. Another is balance and coordination. We may also use auditory, visual, olfactory, or caloric stimulation to increase the firing of your brain. We use non-surgical spinal decompression. This creates a negative disc pressure and helps remove pressure off of the nerve. It also provides a slow stretch of the muscles which fire up the spinal cord, again increasing firing of the brain. Once we've run the necessary tests to determine your specific condition, we can successfully treat you via proper neurological and all-natural nutritional protocols. I want you to ask yourself a few questions. First of all, how has your fibromyalgia affected your relationships, your finances, your family, or other activities? And what does it cost you in time, in money, and sleep, and happiness? Where do you picture yourself in the next 1 to 3 years if this problem isn't taken care of soon? And really, what is it worth to you if we could improve your health condition? Let me make my first recommendation to get you started on the road to recovery. Put this website in your favorites. Read the material below. Watch Dr. Johnson's Treating Fibromyalgia video. If this form of treatment makes sense to you, please call my office and set up your initial evaluation and examination. After reviewing your examination results, we'll see if you meet the treatment criteria. I want you to call me at 205-467-2500. Read the material, watch the fibromyalgia video. Thanks again. I appreciate your time and attention, and I look forward to the day